Hello, my name is Timothy Johnson, and this is my capstone and 5-year plan for Nursing 4580, Synthesis of Professional Nursing with Lamar University. My professional bio sketch. Nursing is a second career for me. Prior to nursing, I had obtained my baccalaureate in kinesiology from Southeastern Louisiana University and worked as an athletic trainer with the University of New Orleans. During that time, I decided to pursue another career and applied to and was accepted to Delgado Community College, Cherry School of Nursing, and graduated from there in 2006. I started my nursing career working in the emergency room as a staff nurse, where I had previously worked as a tech while in nursing school. In 2009, my family and I moved to the Woodlands, Texas, where I continued working in the emergency room as both a staff and charge nurse until 2015, when I transferred to the surgical trauma ICU. There I work primarily as a charge nurse now. I have certifications in BLS, ACLS, and TNCC. I have an anticipated graduation date of December 2018 from the baccalaureate program through Lamar University. And on a personal note, I am married to my wonderful wife of 15 years, and we have two beautiful daughters, ages 11 and 14. Learning outcome number 1, practices safe and effective holistic patient-centered care to a variety of patients, clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This falls under the humanity and society construct, and course Nursing 4550, Leadership and Management in Healthcare, helped to meet this outcome with the assignment Global Health PowerPoint presentation. In this assignment, I developed a PowerPoint on the American Association of Critical Care Nurses, and that helped me develop an understanding of the AACN and their patient-centered resources made available to its members. And then Nursing 4316, Comprehensive Holistic Health Assessment, helped to meet this outcome as well with the assignment Healthy People 2020. This is a national objective for improving health care in America by 2020, and I discussed the objectives for respiratory diseases in the nursing's role. I believe I met this outcome at 100%. Learning outcome number 2 supports patients, clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. This falls under the lifespan health continuum construct. And the nursing course 4620, care of patients with compromised multiple health states, helped to meet this outcome with the assignment Practicum Reflections. In this assignment, I had interviewed a patient with a traumatic brain injury, created measurable goals for him, and found resources in the community to help him and his family in recovery. Nursing course 4316, Comprehensive Holistic Health Assessment, also helped to meet this outcome with the assignment Shadow Health Assignment. With this series of assignments, I was able to assess and evaluate patients with multiple health problems through a computer simulation. This outcome was met at 95%. Learning outcome number 3 evaluates patient-centered care for patient clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This falls under the lifespan health continuum construct. In the nursing course 4580, Synthesis of Professional Nurses, helped to meet the outcome with the assignment The Lewis Blackman Story. This was a discussion post as part of our practical assignments, and the discussion was based on a video of a mother talking about the lessons learned from her 15-year-old son who went to the hospital for surgery and died from septic shock. Nursing course 4620, care of patients with compromised multiple health states, also helped to meet the outcome with the assignment Practical Reflections. All 4 of the practical reflection assignments focused on the patient-centered care and health needs of the traumatic brain injury patient that had been interviewed. And this outcome was met at 95%. Learning outcome number 4 synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. This falls under the evidence-based practice and clinical reasoning construct. The nursing course 4390, Nursing Inquiry and Evidence-Based Practice, helped to meet this outcome with the assignment Critique of Quantitative Research Report. For this assignment, I critiqued an article on ICU RNs and end-of-life care. And this helped me to comprehend the multiple steps involved in the research process of evidence-based practice. The nursing course 4316, Comprehensive Holistic Health Assessment, also helped to meet this outcome with the assignment Shadow Health Assignment. By using the computer simulation patient, I was able to use clinical reasoning in the nursing process to assess the patient's symptoms and needs to develop a plan of care. And this outcome, I believe, was met at 95%. Learning outcome number 5, employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patient clients and members of the interprofessional and intraprofessional healthcare team. This falls under the patient-client-centered care construct. In the nursing course 4321, Nursing Theories and Online Education, helped to meet the outcome with the assignment of the philosophy paper. In this assignment, I studied Newman system theory and her personal philosophy in nursing, and this allowed me to better understand its influence on my practice and philosophy in nursing. The nursing course 4550, Nursing Practice Leadership and Management in Healthcare Systems, also helped to meet the outcome using the assignment Clinical Application Assignment. I used Rogers' diffusion of innovation theory as evidence-based findings to promote change in policy with vasoactive medication. And I believe this outcome was met at 92.5%. Learning objective number 6, differentiates multiple role dimensions and practices with ethical, legal, and regulatory parameters when caring for patient clients as a member of the interprofessional and intraprofessional healthcare team. And this falls under the professional rules of construct. The nursing course 4550, Nursing Practice Leadership and Management in Healthcare Systems, helped to meet the outcome using the assignment Effective Leadership and Quality paper. And this paper was on the characteristics of an effective leader working within an interprofessional and intraprofessional team. Nursing course 4321, Nursing Theories and Online Education, also helped to meet this outcome with the DEC paper. In this paper, I discussed the legal and ethical parameters of the professional nurse, and I believe this was met at 95%. Learning objective number 7, demonstrates professional integrity, effective communication, active inquiry, and service to the community. This falls under the professional roles construct. In the nursing course 4550, Nursing Practice Leadership and Management in Healthcare System, with the assignment to the windshield survey, helped to meet this outcome. With this assignment, I got to look at my own community while driving around in order to make assessments on the community's needs. Nursing course 4620, Care of Patients with Compromised Health States, helped to meet this outcome using the assignment Community-Based Service Learning Activity PowerPoint. In this assignment, I went into the community and spoke with both employees and patients at facilities that provided resources to the patient I interviewed with the traumatic brain injury. And I believe this outcome was met at 100%. My 5-year plan, by the end of 2018, I hope to complete my baccalaureate program with my BSN, and I also need to renew my BLS and ACLS certifications. In the next 1 to 2 years, I plan to continue working as a charge nurse in the surgical trauma ICU. During this time, I'd like to obtain my CCRN and TCRN. I would also like to become a member of the American Association of Critical Care Nurses, the AACN. This is an association whose vision is to create a healthcare system driven by needs of patients and families, where nurses make their optimal contribution. And this is from the AACN website. I believe this association provides the resources, certifications to become a better nurse in the critical care setting. In the next 2 to 3 years, I would like to begin working on my master's degree in hospital administration. I would like to also begin working PRN as the operations administrator, operations administrator at my current hospital. In the next 3 to 4 years, I'd like to have completed my master's in hospital administration and transition into either a manager role in the ICU or to a full-time role as operations administrator. And in the next 5 years and beyond, I would like to continue climbing the ladder into a director's role or into another type of administration role within the hospital. These are my references for this Capstone project, and thank you for your time.